Sir, we are live now. You may start.
Hello, everyone. Am I audible too? Anyone
Yeah.
can say?
Yes.
Okay. So good afternoon, good evening from UAE. It's almost quarter past 3 here in UAE. I hope everyone is okay. Everyone is fine, doing well. So my name is Dr. Adnan. I'll be presenting PLAB 2 OSCE stations for today. This is a very short presentation and we will be doing 2 stations today. If we get time, we'll do 3, but 2 definitely we will do. And we will be having 2 of our presenters with us. They will be doctors, and I'll pretend as a patient, and let's see how well prepared they are. So let's start. A little about me. I'm a graduate of 2005, very old. I've been working in family medicine. I'm a family medicine specialist now. So you can see that I'm a late bloomer. I started studying late after my graduation, but it was sort of influenced from my seniors, and I started taking interest in family medicine. And now, alhamdulillah, I'm doing great in UAE. So I passed my PLAB in August 2023. It looks like it's been ages, but obviously it's not. So I've done few of my post-graduation degrees also, but family medicine is my thing. Something about Instutors. Instutors, as I think you already know, that it's a very, you can say, comprehensive kind of institute that provides you with every support you can imagine. And Instutors help all you guys with exams like PLAB, MRCOG, MRC Chem, PH, anything. So you name it, and we will be here to provide you assistance with anything, okay? Mock sessions are very, for PLAB especially, mock sessions are very, very important. Mock exams also, it helps in any kind of OSCE exam is basically practice exam. So if you are preparing for some OSCE exam without practice, it's nearly impossible to pass the exam. Obviously, there are a few exceptions, but without practice, it's very difficult. So at Instutors, it is, you guys are lucky that we will be providing you with mock exams, especially for PLAB 2. And hopefully you will learn a thing or two about PLAB 2, inshallah. So join us in our journey, invite other candidates also. Let's see how good we are, how bad we are. We are always open for improvement. So if you think that something has to be improved, do let us know, okay? Now, for today, PLAB 2 OSCE examinations, OSCE stations are basically based on chest pain. I hope that all of you have been prepared through this chest pain, and you have done this. I'm not sure at which state of preparation are you guys in, but hopefully you must know that chest pain is a fairly common station in PLAB 2 exams. So we will start with chest pain, okay? Well, these are few of the learning objectives. These are basically the requirements of PLAB 2 exam. So hopefully by the end of this presentation, you will be able to know how to gather data and assess the situation according to need, of course. And you will be able to know the required clinical and management skills. So what is required in clinically and what is required to treatment also. And finally, you will be able to polish your respective interpersonal skills. I'm sure that all of you are aware of these 3 things. Basically, these 3 are the requirements on which you are judged in PLAB 2 exams. So I'm hopeful that by the end of this presentation and by doing those stations, you might learn a thing or two, hopefully. These are some of the common presenting complaints which come under chest pain. Obviously, there are more, but these are the commonest one. MI, angina, pulmonary embolism, pericarditis, musculoskeletal injury, pneumonia, shingles, GERD. Anything can come with chest pain, but these are the most commonest. If I may ask someone, can someone tell me why I have written MI, angina, PE, pericarditis, yani in this order? Can someone tell me why I've written this in this order? Anyone? Aris, sorry, yeah, please.
I think according to how important and the emergency of the case.
How important? Yeah, very good. Yes. Basically, PLAB 2 examiners want to know that what is the thinking of the candidates. For example, if you have a patient of chest pain, are you more concerned about shingles or are you more concerned about angina? Are you more concerned about musculoskeletal injury or you are more concerned about PE? So you are very right that I have written this according to severity of the disease. If you are a candidate, you must rule out MI, angina first thing, starting from MI angina, then coming to PE, pericarditis, musculoskeletal injury, pneumonia. Pneumonia can be before musculoskeletal injury, yes, shingles, and then GERD. So basically, this is according to the severity of the disease, and it should be like that in exam also. So if in exam, you have a chest pain scenario and you are trying to rule out other causes, and if you are trying to rule out GERD, shingles, and pneumonia, and you forget about MI, angina, and PE, unfortunately, that will be a very negative point for you. Even if you start with GERD, shingles, pneumonia, and you have completed musculoskeletal, pericarditis, PE, angina, MI, there is still a chance that the examiner will mark you negative, that you started from least severe and then went to the most severe. So I'm sure every one of you are aware that especially in accident and emergencies, if a patient is coming with chest pain, we have to rule out number one, MI, angina. Not we don't have to rule out GERD and shingles at number one. Yes, we have to rule out, but not at number one. And with 8 minutes of time, I think it is nearly impossible to cover all the things. So you have to act smartly, and you have to rule out all the things. I'm not sure whether you have practiced these scenarios according to the differential diagnosis or according to red flags, and I'm not sure whether you will get time to rule out all the diseases. So kindly make practice as you at least you rule out first four: MI, angina, pericarditis, and PE. If you will do these, examiner will be happy. An examiner is not more concerned about shingles or GERD. The examiner is more concerned about MI angina. I hope I'm clear. Moving forward. These are some of the mnemonics which I went through when I was preparing for PLAB 2. I'm sure every one of you are preparing from different, you can say different notes, different textbooks, different institutes, or wherever you are studying individually or with your friends. But these are the few mnemonics which I believe are important in chest pain scenarios. Again, someone can tell me about these mnemonics. If someone has not been familiar with these mnemonics, kindly tell me, please. Is there anyone who is not familiar with these mnemonics? No one, I guess. Okay. So is there someone who is familiar? I think every one of you are familiar with these mnemonics. So I need one candidate to explain these mnemonics for me, please.
So, Socrates is for pain,
Good.
and S is the site.
Good.
O is onset. C is the character. R is to ask if it radiates to. No, yeah. I
Okay.
think the relieving factors. R is relieving factors.
Okay.
A is aggravating factors.
Okay.
C is for timing.
Yeah.
E is for what was E? I think E is
Doctor, if you don't know, no issues with that. Just go through it.
I
I'm
got
not here to judge you. No,
yeah,
please don't think that I'm here to judge you. We are all
yeah,
here to learn. So we are hopeful that we will learn something at the end of this presentation.
yeah.
So
I
let's
know.
do top, please, and then go to eyes, please. What is eyes?
So ICE is idea, concerns, and the expectation of the patient.
Very good. Flaws.
The flaws is fever, loss of weight, loss of appetite, and yeah, loss of weight, sorry. F is lumps and bumps,
Okay.
appetite, loss of weight, and I think that's it.
Okay, no problem. Desas.
Then the diet, exercise, smoking, alcohol, and sexual history.
Very good. Next. Maftosa.
Aftosa is medical condition, no
Good.
medication, the medication, medical condition, allergies, family history, travel
Mm,
history,
good.
the occupation,
Good.
smoking and alcohol.
Okay, that's very good. Thank you, doctor. Thank you very much. Well, as I said before, that there are different kind of notes circulated in the market, and all of you might be doing some probably note A, someone is doing notes B, someone note C. It does not matter. These mnemonics also does not matter. The important thing is, if you, I believe, because I study like this, I believe if you include these mnemonics in your notes, it will be more effective and you will do better, because it will help you in learning. Learning is very important. So we will come to these mnemonics later on. Let's move forward. So can you see the heading? Gathering and assessing the situation. As I told you before, there are basically three kind of requirements which PLAB2 examiners want from you. First is gathering the data. Second one is medical assessment and the clinical or medical assessment. And the third one is interpersonal skills. So coming to the first part, the data collection, gathering the data and assessing the situation. Basically, these are two things. One is the data gathering, which I'm sure all of you are doing for the past many years. The other thing is assessing the situation. Now we are assessing the situation for the past many years, but some students are more better at this than there are other students. But it is equally important that whether you are assessing the situation right or not. Okay, I will explain it later on. So basically, the gathering the data and situation, assessing the situation, it is the main bulk of the station. It comprises around 60% of the station. This is obviously my calculations. You can have your calculations as you want. So I believe that a station comprises 60% of gathering the data, yani history taking. So the main bulk is the history taking. although it comprises around 60% of the station, but it carries equal 33% of marks with the rest of the two. So how much time should we spend on this? Since this is your base, so you must spend the main bulk of time of your 8 minutes on this, because this is your building. This is your base. If you will not prepare the base properly, your building might collapse. So you must spend a good time on this. Some people say 4 minutes are enough. Some people say 3 minutes are enough. Some people say 5 minutes, 6 minutes are also needed for assessing the situation and for history taking. It depends on stations, basically. This is just a general rough idea that you have to spend at least 4 minutes to assess the situation and to gather the data as to what is the situation, what is the station for. So I believe out of those 8 minutes, 4 minutes, at least 4 minutes should be spent on gathering the data or history taking. Now, you are familiar with everything. You are familiar with history taking and everything. Of course, you are doing since ages these things. But we have a very limited time of 8 minutes there. So there is a very heated debate among PLAB 2 participants that whether should we memorize the questions or whether we should not memorize the questions. You must have heard that memorizing the questions is not helpful. You will become very, very robotic and very, you will not perform well because you have memorized all the things. Of course, there are different school of thoughts. I am from the school of thought which believe that memorizing the questions is very, very important. Why it is very important? It is very important because, again, we have only 8 minutes there and we have to spend only 4 minutes at history taking. So if we will not memorize the questions, how would we know what questions we have to ask from there, right? At that time, at when you are taking PLAB 2 or when you are in front of the examiner, in front of the patient, there are multiple pressures on you. Of course, 8-minute pressure, time pressure is there, and there is pressure that you are being judged, you are being assessed with the examiner, and the patient is also assessing you. So there are multiple pressure there. So if you are not memorizing the questions, you will lose plenty of time. So to save time, I think it is better if you memorize the questions of history taking. Okay. Having said that, do memorize the questions, but please, please, please do not forget to adapt and improvise. Kindly understand this point that you have to memorize the question of Socrates, yes, but you have to adapt also. For example, there is a chest pain complaint and you are asking the Socrates question. Now, if the patient is complaining, doctor, I'm having pain, please, doctor, do something for this, but you are more concerned in completing the Socrates, you are not adapting, you are not improvising. So if you are not adapting, this leaves a negative impression on examiner. So yes, definitely you have to memorize questions, but at the same time, you have to adapt according to the situation. That is why this part contains two portions: data gathering and assessing situation. So if you are not assessing the situation, you are more concerned about gathering the data, you will not get the full 33% of the marks. You will not get the 4 marks there, 4 points there. So you have to improvise, you have to adapt according to the situation. Similarly, ask the relevant questions and forget about irrelevant questions. When we will do the stations, you will learn more about this, that what are the relevant questions and what are the irrelevant questions. For example, in let's say if a patient in ER, he came there for chest pain and he is in very severe pain. The pain intensity is around 8 or 9. And you are more concerned about giving, what can I say, lifestyle modification. Now, these are irrelevant questions there at that time. That patient is in severe pain. He is in accident and emergency. So asking about your exercise routine, asking about your sexual history is not important. These are irrelevant questions. I know you have memorized all these things, but you have to adapt at that time. And how would you adapt? By practice. So if you will practice, you will get to know how to adapt to a situation. And then you can do better at that point of time. So please memorize the questions, but please don't forget to adapt. Lastly, I have seen many candidates while gathering the data, they are more, again, you are more robotic there, and you forget that you have to do vitals and you have to do examination. You are more concerned about your questions being completed, that you forget about vitals and you forget about the examination. So please keep in mind that in the 4 minutes or 5 minutes of time, you have to do the vitals also, you have to do the examination also. I have written focused examination. Why focused examination? Because let's say if a patient is coming with chest pain, you are more concerned about his heart, you are more concerned about his lungs, so you will examine heart and lungs properly, but you are not more concerned about you can say the resonance of chest. You are not more concerned about that. So do a focus examination, please. I hope everything is clear. I'm moving forward. This is a little joke on gathering the data and assessing the situation. There is a patient who is saying, will I be able to play the piano after this operation? The nurse says, sure, of course. And then the patient says, that's awesome because I could not before. If someone can explain to me what is wrong in this joke. Can you relate something with the data gathering? Anyone, please? No one? Okay, I'll let you know. I'm sorry, I'm not looking at the chat, so I'll see what is, I don't get it. What is common, what is flow? Kindly put these questions for later on. I will answer these later on, please. Okay, so basically the joke is about the data gathering. Now the nurse or the doctor, he was more concerned about completing the questions and he was not focusing on the patient. During the data gathering, I'm sure he did not ask about the hobby, the occupation of the patient. And when the patient asked, will I be able to play piano? He said, yeah, you can play the piano. But on the other hand, he was not a pianist. He did not know that he was not playing the piano before. So gathering the data is very important, and focusing on patient is also very important. This is another joke. I'm not sure whether you can read this or not. There is a doctor and a patient. The doctor says, knock, knock. The patient says, who's there? The doctor says, the interrupting doctor. The patient was just about to say the interrupting doctor, but the doctor interrupted her and said, you have cancer. So interruption while gathering the data is very, very bad for your marks. If you are not a good listener, you will not gather the data. And if you are not a good listener, you will jump to the conclusion and you will say something while the patient was talking. And of course, this will get you in trouble. So please focus on patient. Give him or her time to speak. Give him or her time to talk, to tell you about complaints. And don't interrupt, please. It is very important in data gathering. It is very important in data gathering, and it is also one point for interpersonal skills also, whether you are interrupting or not. Coming to the second part, the clinical and management skills. I told you before, the data gathering and assessment of situation, it comprises around 60% of the bulk, and it carries 33% of the marks, 24 marks. According to my calculation, clinical and management skills comprises 20% of the station, and it carries equal 33% of the marks, yani 4 marks. So you can see here that the clinical and management skills equally important in perspective of the marks, but it is, you can say, not the chunk of the station. So you can complete this clinical management skills in 2 or 3 minutes, maximum 3 minutes. 2 minutes, I think, is a good time, but maximum 3 minutes. Try to practice and try to mold yourself in completing this management skills in 3 minutes. Again, the treatment plan, I believe, should be memorized. Obviously, if you have not memorized the treatment plan, you will not complete the management within time. And let's say, for example, you have to tell 4 points in management, you will be able to complete only 2 points. So you must memorize the treatment plans, but you have to adapt according to the needs of the station. Okay, adaptation is very, very important. The management or the treatment plan must be patient-centered, and it heavily depends on patient's demands. Let's say, for example, if one patient is coming to you with chest pain, and he's saying that you asked everything, and you said you asked that what are the main concerns, and he said the pain is my main concern. So he wants to know about the pain medication. If you will forcefully tell him about the medications of heart, medications of blood thinners and everything, he will not listen to you. He's more concerned on pain. So yes, you have, if you are not telling him about pain medications, again, you will get a negative point for this. So please be patient-centered. Ask the questions, ask the concerns, what are the concerns of the patient, and then starting from that concern, you can tell that these are the management plan, and this will be made with the patient. You can definitely tell the patient that this is good for you, this is not good for you, I think this is better, I think this is not good for you, and then patient will say okay, okay, or not okay, like this. So the management skills and clinical skills comprises 20% of the station. It should be completed maximum in 3 minutes. You have to memorize but adapt, and it should be patient-centered. I hope this is also clear. Now there is one patient with the brain tumor. He also have dandruff. The doctor, he's telling the brain's tumor is incurable, but let me give you something for that dandruff. Now the patient is more concerned about the tumor, the treatment of tumor, but you are more concerned about giving treatment for dandruff. So again, this is a negative point. You are not patient-centered. You did not listen to the patient, or you did not ask about the concerns of the patient. So please ask about the concerns, because these concerns will, at the end of the station, determine your management skills, your management treatment plan. Again, another scenario, doctor, my back hurts when I wake up in the morning. The doctor said, well, wake up in the afternoon then. I believe this is a good option. The doctor is giving an option to the patient that if your back hurts in the morning, okay, wake up in the afternoon. Yes, very good. This is an option. But obviously, this is an option in a rude way. So you will have negative interpersonal skills marks from there. Same goes here. The patient says, I broke my arm in 3 places, and the doctor says, well, don't go to those places. Again, an option. Doctor has given an option, but in a rude way. These are just the jokes, so just to distract you guys. Okay, now the last thing is interpersonal skills. Interpersonal skills, again, according to me, comprises 20% of the station and carries equal 4 marks. Now, this is also important. I need one candidate or someone. Haris, can you please open mic of one participant, please? I will be asking few questions, so please, I need one candidate.
Sure, sir.
Can someone volunteer to answer these questions? I will be asking a few set of questions here. Anyone?
Hi, Dr. Can you please open your mic?
Do we have someone?
Hello, Dr. Adola, can you please open up your mic? I guess, Dr. Adnan, they all are very shy. I don't know how you guys will gonna pass your exam if you're this much shy. You have to pass your exam. Please open up your mic and participate.
Just one. This is not something which I'm judging you. I'm giving marks to you. This is just for your practice. I need one participant, please.
Yes.
Sure, I can volunteer.
Okay.
Thank you very much. Who's this?
Dhruvi.
Sorry?
Dhruvi.
Dhruvi. Dhruvi, how are you?
I'm good. How are you?
Good. Thank you. Dhruvi, kindly tell me how much time should we spend on this interpersonal skills? Just a hint. I just want to know what's going on, what's cooking in the.
I think interpersonal skills is something that is going on in the entire station, and there isn't necessarily a time frame that you can put on it. But
Very-
if you would ask me like a number, I would say the first minute or so where you're first entering the station and meeting the patient for the first time.
Beautiful. Very good. There is no time limit for interpersonal skills, basically, and you are very right that for the whole 8 minutes, we are continuously doing interpersonal skills. Very good. The next question is interpersonal skills. Is it something God gifted?
No, you can work on it.
So it is not something which is God gifted.
I think some people have good interpersonal skills, but it's not necessarily God gifted. It's something you can work on.
Very good. My next question was again related to that, and you have answered that very beautifully. That it is, yes, some person are God gifted. They naturally are good at communication. But yes, we can learn interpersonal skills. It is not some rocket science that we cannot learn. So yes, you are very right. And again, this needs practice. If you will practice, your interpersonal skills will become much, much better. So should we be natural while performing?
Yes.
Okay. What do you mean by natural? I'm basically asking about interpersonal skills. Okay. So kindly let me know what's the meaning of natural, because I've heard a lot of talk about please be natural when you are in the exam. Just be natural. So what's the meaning of this natural?
I think if you try to like fake empathize or try to use words but you don't actually mean them, the patient can sense that, and that kind of gives you a negative in your interpersonal instead of it working in your favor. Even if you're using the right words, but if you don't mean them, they don't make sense.
Mm-hmm. So being natural is something God gifted?
I wouldn't know. Probably not.
Yani we can improve on this also.
I think so.
So I think that during the exam, it is very difficult to be completely natural, and we have to learn few tricks to look like we are natural, right?
Yeah, sure. Yep.
Any practice, right?
Yes, practice. Yes.
Okay. So next question, what if the patient is wasting our time? You have 8 minutes of time. You are just more concerned that you have not finished the questions yet. You are on history taking, still on history taking. You have to do vitals, examination, management, everything. And the patient is wasting your time. So at this, and I'm sure that this thing comes in every candidate's mind. So what will you do at that point of time? Yani, I'm basically asking that, for example, if the patient is, you believe that you will not complete the station, So what about the interpersonal skills at that point of time? Would you just leave behind the interpersonal skills? Would you go forward with your with completing the station, or what would you do? Yani you have the fear that if I will not complete the questions, I might lose the station.
Either try to diplomatically kind of maneuver the conversation back on track if it's very off track, or I think the patients in the exam scenario, I believe that the patients are also given a set of instructions. So if they're going on about something, you I think you can just let them continue. Keep your interpersonal skills, but at the same time also try to maneuver the conversation back to the station.
Very good, Ruby. Because patients are basically not wasting our time. They are, as you said, they are guiding you through the process. They are guiding you through the questions. So basically, if something comes in your mind and you believe that maybe I will not complete the stations, maybe I will not, I will skip this and I will skip that. So to hell with interpersonal skills, and I will go and move forward. Please don't do that, because interpersonal skills, although it carries 4 marks, it is equal in data gathering and with the management skills, but it is the core of you can say core of the station. So if you will force the patient to do something else, again, this will cause negative. And this interpersonal skill is very tricky. Interpersonal skill is basically, although it carries 4 marks, but it sort of, because there are human who are judging us. The examiner is also human. So if the examiner believes that this candidate is not good and it is bossy and this and that, maybe he will not be lenient with you in data gathering, or maybe he will be very strict in management skills. So please try to be natural. Yes, try to be calm. No one will waste your time. Try to complete the scenario, as Ruby said, that try to maneuver the patient, but don't ever force the patient to, or don't ever force yourself to leave the interpersonal skills. Show empathy. Yes, empathy. We have heard this a million times, and still I'm very surprised that few of us, we don't show empathy, not even in our practice, and not obviously not in our exams also. If you are not good in showing empathy in your practice, you are not good in showing empathy in the exams also. So please, empathy will help you pass the exam, and empathy will help you to be a good doctor and good human being. Lastly, Rui, thank you very much. Thank you. You can unmute your mic, please. Thank you very much.
Thank you.
Now, the last thing is very important. First impression is the last impression. As I was telling you, that from the point you will enter the cubicle, from the point you present yourself there, your impression will be on the examiner and on the patient. So if you are not well dressed, your impression will be bad. If you are not smiley, your impression will be bad. If you are too loud, your impression will be bad. If your voice is not clear enough, your impression will be bad. So first impression is the last impression. As I said, that examiner and patients, they are after all human beings. No matter how much check boxes the examiner have to check, he is or she is a human being. If you have given a good impression, first impression, most probably they will be lenient and they will give you marks in let's say interpersonal skills or data gathering or whatever. They will believe, oh no, the doctor is very good, but yeah, he forget this thing, leave it, just give him mark. So this is very important. Interpersonal skill, although comprises only 20%, but I believe it is the heart of the station. A little joke on interpersonal skills. The doctor to the patient: you are very sick. The patient said, can I get a second opinion? And the doctor again said, yes, you are very ugly too. So doctor is not focusing on the patient, and his interpersonal skills are very, very bad. He just was abrupt, and although the patient was ugly, so no problem with that. But again, You don't have to say some things there. All right, coming to station, the part you will all have been waiting for. I think you are bored from the presentation so far. So let's move to the station. Who is the candidate now who will present the station?
Dr. Dola, are you there?
Yes, yeah.
Mute your mic.
Okay.
Doctor, can you spell your name from me?
Adeola.
Again, please.
Adeola.
So how do you pronounce it?
Adeola.
Adiola. Adiola, how are you?
I'm okay.
So how's the preparation going?
I'm trying my best.
Very good. Positivity. Okay. When is your exam?
The 1st of March.
1st of March. So you have a few days left. Yes.
Yeah.
Very good. Very good. Just be positive. Just be confident, and hopefully you will clear the exam. It's nothing. It is a doable exam, definitely. And well, we just need confidence. We just need some push or some positivity to clear the exam. Are you prepared?
I
Are
think
you
so.
very good? So ready to present?
Yes.
Okay. Is there anyone who will be calculating the time, Haris? Or should I do that?
Yes, sir.
Someone will be calculating the time of station, or should I calculate the time? I think it is better if I do it, okay?
Sir, could you please guide me how much time is required?
No issues, Haris, I will do it. No problem. Thank you.
Okay, sir.
Thank you very much. I will just open my stopwatch and reset it. Okay, Arula, ready?
Yes.
Okay. Obviously, you have 2 minutes to read the station and then our time will start. Okay.
Okay.
So this is your first station. So Ariola, what do you get from this station?
The patient has a chest pain.
Okay.
So I'm to ask questions about the chest pain and try to know what exactly is the cause of the pain.
Ariola, do you make sense of this station? This question, do you make sense of it?
Yes.
Well, you are a very good student then, because you can make sense of such an absurd kind of question, such an absurd kind of station. Then you are on the right track, and you are doing very great, Ariola.
Thank you very
Basically, I cannot make sense of this station. You know why?
Why?
This is very incomplete station, incomplete information. But I just wanted to know how prepared you are. And I am very happy to tell you that you are very well prepared. Even with this limited kind of information available to you, you were well prepared, and you were positive in completing the station. So kudos to you.
Thank you.
Now just see if I do a little change in this station. What did I change, Adiola?
You change the location is in the emergency room. So it shows that it could actually be something serious.
Very good. So basically, if we put in place, it helps, right?
Yes.
Okay. Now see this, please. What have I added? Anything
So
added?
this is giving us information about the age of the patient, and then it would make me start thinking of what can cause an elderly someone of 50 years old to present with chest pain.
Very good. So now you know the patient is in ER and he or she is 50-year-old with chest pain. So you are making diagnosis in your mind, in your brain is working basically, and you are making diagnosis that this could be the reason of chest pain, right?
Yes.
So basically, all these information are helping you in preparing yourself, right?
Yes.
Okay. Now I'm changing once more. What information you gather now?
This is telling us he's obese, and I'll be thinking about the obesity is a risk factor, so some cardiovascular diseases. So I can be thinking about maybe is MI or angina, acute coronary syndrome, and because of this obesity,
Very good.
later in the history, I want to know if he has hypertension or any risk factors as well.
Very good. So basically, if I change the scenario, you get better if there is more information there in scenario, right?
Yes.
So this thing is if the patient is 50-year-old obese male with chest pain in ER. Now, if you compare this scenario with this scenario, now do you believe that this scenario is very absurd?
Yes.
And still with this absurd scenario, you were well prepared and you were ready to perform the station.
Yes.
So this means that you are on the right track. So be positive, be confident, and expect the unexpected, be prepared for everything. Now, most of the time, you will get a scenario like this. There will be information outside. There will be information, and you will be making some points within the 2 minutes. So the question helps you a lot in deciding how to present yourself. Okay.
Okay.
But you have to prepare yourself for the unexpected. So, yes, sometimes, rarely, station will come with this kind of information. Rarely, very rarely. But usually it comes like this.
Okay.
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 So now I think you don't need 2 minutes of your time, right?
Yes.
Okay. So we will start the scenario and I will try to complete it. Just give me 1 minute. I will prepare the check boxes.
Okay.
Okay, Riola, your time starts now.
Hello, I'm Dr. Adeola, one of the doctors in the emergency. Can you confirm your name and age, please?
Yeah, doctor, my name is David.
All right. All right, David. I can understand you have some chest pain.
Yeah, doctor, it's killing me basically.
Oh, I'm sorry about that. I will try my possible best to see how I can help you. Is that okay?
Yeah, doctor, thank you.
Can you tell me where this pain is coming from?
Well, I think it's in my chest.
All right, what side of your chest?
In the middle, probably. I have no idea, doctor.
All right. So this pain, can you describe it for me?
What do you want to know, doctor? It's very painful.
All right. Does it radiate to any other parts of your body?
No, doctor, I don't think so.
Okay. So this pain, since when have you had it?
I think it's been half an hour.
Okay. And has it gotten better?
No, doctor, it's getting worse.
All right. So does it come and go?
No, doctor, it's still there. It's been half an hour and still there, killing me.
And what were you doing when it came?
I was doing nothing. I was just roaming around.
All right. And is there anything that makes it better?
So far, no, doctor, nothing.
Does any, does anything make it worse?
It's been getting worse, so I don't think so. It's something is there.
All right. I can see that you're quite in much pain. I'll try my best to be quick with this. Is that okay?
Thank you. Yes, I'm in very painful situation, doctor.
All right. So does this pain get better when you lean forward?
Let me see. No, doctor, it's not getting better.
Okay. And do you feel sweaty?
Yeah, I am feeling sweaty. Yeah, because of pain. Yeah,
Do you feel nauseous?
a little bit. Yes.
And did you actually vomit?
No, no, doctor, I did not.
And do you feel the pain around your shoulder and your neck?
No, not.
All right. Has it happened before?
A few times before, yes. It usually is comes and goes, but this time it's very severe.
Okay. And do you notice that maybe when you are in a rest position, it get better?
No, doctor, it's not getting better.
Okay. Any flu-like symptoms recently?
Sorry?
Do you have any flu-like symptoms
No,
recently?
no,
Any fever?
no,
Do you have pain on your legs?
no,
And did you travel on a long flight recently?
no, doctor, no.
Okay. So just a bit about your health. Are you being managed for any medical condition?
No, doctor. Sometimes my blood pressure gets high, but no, it's sometimes.
Okay. And is there any medical condition in your family?
In my family, yeah,
Yeah.
we have blood pressure, high blood sugar, and we have heart diseases also. Yes.
Right. Um, just a bit about your lifestyle. Do you smoke?
No, doctor.
Do you drink alcohol?
No,
Are you on any medication you have to take every day?
no, doctor.
And do you have any allergies?
No, doctor.
Okay. And what occupation do you do?
Well, I'm a businessman.
All right. And who do you live with?
My family, my wife Allah, oh my God, my wife and two of my sons.
Okay. So is there anything, any idea? Do you have any idea what's going on?
Well, I believe I'm having a heart attack.
Okay. So what all right then. I'm going to try my best to see how to address this. And do you have anything that concerns you the most?
Well, this heart attack, I'm afraid I'm having a heart attack.
All right. Right now I'm going to quickly examine you. I'm going to check your vitals and I'll also examine your chest and I'll listen to your heart. I'll do this in the presence of a chaperone. Can I go ahead?
Please, doctor, but just be quick, please.
Okay. And I also want to ask for an ECG just to know what's going on. Is that okay?
Yeah. It will
All
help.
right. So, thank you very much for answering my questions. And from my assessments, I'm
Vitals
so
show high BP, high pulse rate, and the ECG is normal.
um from my assessment, I'm suspecting you are having something called an heart attack, which is a myocardial infarction.
Yani, that was true. I am having a heart attack.
So right now, from my examination, doesn't really gives us the right picture. I'll have to ask for some cardiac enzyme, which is a test to confirm it. But in the meantime, I'll have to treat you as like you're having an heart attack. Are you with me?
Yeah, please. I also believe that I'm having a heart attack.
Okay, so right now, I'll first give you a very strong painkiller, and
Okay.
I'm also going to be giving you oxygen,
Okay.
and
Okay.
then right, I'll give you some I'll give you some tablets like aspirin. Are you with me?
Okay. Yeah, yeah.
So I'm going to give you something we'll spray under your tongue. Is that okay?
Uh-huh.
Just to get some relief. While
Yeah,
we
yeah.
wait,
Doctor, do
uh,
something.
okay, while we wait for the cardiac enzymes to come back. Is that okay?
Yeah, yeah. Please, please do
I
whatever you
will.
want.
All right, thank you. I'll also invite my seniors so they can come and assess you as well. Is that
That would be
okay?
that would be great. Oh
So
my.
how do you feel right now?
Uh, Doctor, yeah, the I don't think it was much of help.
Okay.
Yes, I feel a little better, but not too much. Yes.
All right. So also I would like to involve the cardiac doctors that take care of the heart. I would also like to invite them to also come and assess you. Is that okay?
Yeah, please, please.
All right. So I'm also I'll try and also see with the painkillers and also if that will help your pain. Is that okay?
That would be great, doctor.
I'll give you more dose of that. Is that okay?
Yeah. Yes.
Right. So is there any concerns you have? Any other concerns?
No, doctor. I'm just concerned about my heart. I hope this ECG showed something to you.
From the ECG, we can't really say exactly, but with the symptoms you're having is definitely sound like an MI, and I'm
Uh-huh.
waiting for cardiac enzymes we requested for to also come out, and that will
Okay.
give us tell us specifically if we are dealing with an heart attack. Is that
Oh,
okay?
time's up. Time's up.
Thank you very much.
Thank you very much for doing this station. And first of all, please tell me, how did you do? Out of 10, how did you do?
Maybe 5.
Why 5, Dadiola?
Um, the management.
Just tell me, please, 2 of the positive things you did here.
So the positive thing is I was able to ask questions to confirm my diagnosis
Okay.
and also able to examine the patient and I requested for ECG and cardiac enzymes.
Very good. Very good. And what are the 2 or 3 negatives which come in your mind?
So I feel I was not able to manage the patient well because he was still having chest pain even after giving the painkillers
Yeah.
and um,
What kind of painkiller did you give?
morphine.
Did you say
That's
that?
I didn't say it. I just said a strong painkiller.
Okay. Okay. What else?
Um, uh, uh, maybe in my history. I don't
History.
know.
Okay. And did you make up with that? What was the problem with this patient?
Yes, I think he's having myocardial infarction.
Okay. And how did you conclude that?
So he said he has a pain that's an acute pain that started suddenly half an hour ago. Though he said it doesn't radiate anywhere else, but
Yes.
he has a strong family history of that condition. And he also said he feel nauseous, though he
Mm,
didn't vomit and he was sweating.
yeah.
So
Oh,
I the
so
myocardial infarction.
those points you concluded that he might be having a heart attack.
Yes.
Okay. And what about you asked about the family history, very good. You asked about his I think you asked yeah, your vitals you did. I told you about the vitals exam. Chaperone was a very good thing. Chaperone is very important, so please mention that thing. Uh, so is it okay if I come one by one? I'll go through one by one. Is it okay with you?
Okay, it's okay. Thank you.
So well, let's begin from the first point, history. Now, Ariola, this patient was in pain, right?
Yes.
I think I'm a good actor. And I was trying to tell you that I'm in severe pain. Okay.
Yes.
I'm not sure. I'm not sure what kind of notes you are going through, or I'm not sure where are you practicing from. But again, all these practices, all these notes are different. So everyone is different in his or her management plan. So what I learned, I'm not sure whether this is correct or not. Again, what I learned is whenever a patient is in pain, so you have to offer him or her the painkiller at the very beginning. Does it make sense?
Yes.
Okay. Did you know about this fact before?
Yes, I know about it, but just that so many people say different things. Some
What,
people say what if,
here, what is the confusion? Kindly tell
some
me
people
because I can help you.
okay. Some people say, what if you offer the painkiller and the patient says, yes, give me the painkiller? That's how will you be able to do that? So it's
So
best to
you be
ask.
able to do that. Let's say, for example, if you are asking a painkiller in the very beginning, very first minute, and I said, yes, please, doctor, give me painkiller because I'm in severe pain. So then what would you do?
Then I'll turn to the examiner and say, can I get painkiller for my patient?
Very good. And then what? You will give the painkiller, and afterwards, maybe after 5 seconds, you will ask again, how is the pain now? And I will say, yeah, it's better. And then what?
Then I would continue asking my questions.
Very good. So what is the confusion here?
So some people said it's wrong to give painkiller because you don't really know what you are dealing with yet.
Aha. Okay. This is one point. I will write it down. What you are dealing with. Okay. Any other thing which goes against this thing, against giving of painkiller in the beginning?
Mm, those are just the ones I know.
Okay. Okay. So again, Diora, I will go one by one. We will just clear things out here. Now, as far as my experience is concerned, as far as my mentors and my teachers were concerned, as far as my colleagues and my friends were concerned, if you are giving a painkiller in the beginning, you will get interpersonal skills marks, and you will address the concern of the patient, which is pain, of course. So again, the first impression is the last impression, as I said before. So you are addressing the concern, and you are getting the marks for interpersonal skills. Now let's
Okay.
say so what the history will be same. Again, the patients there, they are actors. They have told they have been told that you have to tell these questions, these answers. The doctor will ask these questions, and you have to answer these questions. So
Okay.
if you give the painkiller in the beginning, it will help you a lot, because the patient is if is in pain, he will not be able to answer your questions properly. And for the whole time I was telling you, I'm in pain, doctor, do something, right?
Yes.
Please, if you see something like that in your exam, kindly offer painkiller to that patient.
Okay.
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 In history, you asked about the pain symptoms. Very good. You asked about the site. You asked about the onset, the character. You asked about what kind of pain is this, radiation. You asked. So all these Socrates, we don't have to ask all the Socrates, but you have to get the point. So you had a good point that I was nauseating a little, and I was sweaty also. So yes, do you think that this nausea and this sweatiness can come other than MI?
It's a possibility.
A possibility, right?
Yes.
So being nauseating and being sweaty does not typically point towards a heart attack, right?
Yes.
Okay, good. So you covered all that points very, very brilliantly. You covered all that points. Now, after the complaints, I believe that you also asked about whether I had this previously or not, and I told you yes. In the past, I had this problem before, sometimes coming, but not that severe, right?
Yes.
But you did not explore that thing. How did it improve? What was wrong at that time? You did not ask questions about that,
Okay.
right?
Yes.
If you can ask some questions, I think you would know that these were few episodes, only 4 or 5 episodes in probably 6 months, and they were not that much severe.
Okay.
You asked about the medical history. Yes. You asked about my medication, allergy, family, travel, occupation. Brilliantly, you did all those things. And you pointed out that my family history of hypertension, diabetes, and ischemic heart disease also again pointed you towards heart attack, right?
Yes.
Good. And I also told you that my BP is sometimes gets high, but not often. Okay.
Okay.
You did the exam very well. You did the vitals very well, although I needed one BMI there. I believe whenever you are saying that I will do the vitals, kindly mention blood pressure, pulse rate, respiratory rate, temperature, and BMI. If you are not mentioning, if you are just saying vitals, it will work. I think it will work, but it will not give you full marks.
Okay.
Okay. So please mention that I will check your vitals, which includes blood pressure, pulse, temperature, respiratory rate, and BMI, because he was an obese patient, right?
Yes.
So if any station coming with chest pain, you have to mention these things: BP, pulse, temperature, respiratory rate, BMI in vitals. Okay.
Okay.
Very good. Examination, you did well. I told you about the examination findings. I told you that there is high blood pressure, there is high pulse rate. I did not tell you about BMI because you did not ask for BMI, although I had that BMI result with me. I told you that ECG was you mentioned ECG point brilliantly, and you did a very well thing, good thing about this ECG thing. And I told you that ECG was normal, right?
Yes.
So when I told you that ECD was normal, did you get confused or not?
I got confused, but I just felt like is it the sometimes a non-STEMI is
Yeah.
non-STEMI heart attack, and I
Okay.
felt like after doing the cardiac enzyme, that would
Mhm.
let us know for sure if it's
Uh,
actually MI or not. But it's
okay.
still better to go on with the management. Then after that, we'll be able to review it with the seniors and
Okay. Okay. That's very good. You asked about my idea. You asked about my concern. Very well done, because this is most important. That what is the patient going through? What does he or she believe? And what is he or she expecting? That's very good. So ICE you covered brilliantly. Okay. Now coming to management part, you explained the provisional diagnosis very well. You told me about the heart attack. Although I think it would have been better if you explained a little bit more about heart attack. You did not, you can say, in layman's words, you did not explain that how a heart attack comes. You know
okay.
that, right?
Yes,
What is the pathology? Of course, we don't have to tell the pathology to the patient. We have to tell him or her in a layman's words, right?
yes.
And you did not do that.
Yeah, I didn't.
But you explained that you are suspecting a heart attack. So that was a
Yes,
good. Again, you involve the seniors, very, very important, because you are an FI2. You don't know how to treat or how to manage this thing. So you involve the seniors. Okay. You did
yes.
investigations. Important thing was cardiac enzymes. This was very, very important. But other labs and other investigations were also important, like chest X-ray, like CBC, like liver enzymes, renal function test. So I believe that you had to mention those things also.
Okay.
But if you are getting short of time, you can only say blood investigations and urine tests and cardiac enzymes, or heart markers or cardiac markers, whatever you want to tell. Okay, if you are short of time.
Okay.
Now, symptomatic treatment you gave me. You gave me painkiller, you gave me sublingual, you gave me oxygen. So all those things were really helpful and right on the track of some patient who's having a heart attack. And when you ask me again, I tell, yeah, it's a bit better, but not much, right?
Yes.
And of course, the time finished, but the safety netting and follow-up plan did not come because the time was finished. Now, you know what this patient was, this station was of GERD, gastroesophageal reflux disease. So if I tell you that this patient had reflux, does it make sense?
Yes.
How?
Because he mentioned that he has had the pain before.
Yeah.
If I'd asked the question, I would have got that information. And also his weight.
Yeah. His weight, his history probably could have been a little more, you can say, extensive. His normal ECG, and his pain still not going away with the painkiller. So I think it could have been much better. You did a great job. Your practice is very good, but you need a little more practice. But you are on the right track. As I said before, I believe the number one thing which passes you in an exam is your confidence level. Your confidence level is very high, which is the number one thing needed to pass an exam. Okay.
Okay.
So please don't be disappointed with this presentation. You are on the right track. Just a little practice. Okay. So
Okay.
if I want to give you marks, you know that there are 4 marks for gathering the data. You know there are 4 marks for management and 4 marks for interpersonal skills.
Yes.
Okay. So in history or data gathering, how would you rate yourself? How many points will you give? How many marks will you give?
Like 2.
2. Yeah, I think I also will give you 2. Okay. Because you did not come to the conclusion of having this reflux. Okay, in management part, how much would you give? Although you managed the patient for heart attack, which was very good, but still, how much would you give?
1.
I will give you 2. You know why? Because
Why?
you're behaving like a safe and a good doctor. You are more concerned about his heart condition, and that's why you involve the seniors and you give the painkillers. So I will give you 2. I will not give you 1. Okay.
Okay.
Because you were a good and a safe doctor, you are more concerned about the patient. So I will give you 2 there. Okay.
Okay.
Interpersonal skills. How many?
Maybe 2.
2. Yes, I will also give you 2, because again, the most important thing was the first 1 or 2 minutes where you could have given me a painkiller, where you could have assessed that I'm in severe pain, and you were not. It looked like, although you were concerned, it looked like you were not bothered about my pain. So I will give you 2 there. So a total of 6. I will give you on this station. This is not bad. Anything above 5 is not bad. Okay.
Okay.
But it definitely needs improvement. Any questions, Adiolia?
Um, thank you very much for this session. I really appreciate. From
No.
this presentation, so my mistakes were that I didn't explore that history, the previous history of the chest pain.
Yeah.
So, and just to actually pay attention to every detail the patient is giving me.
Yes.
So, now the question is, what if I'm not able to come up with a diagnosis like this?
Okay, that's very good question and very valid question, and happens a lot during exam. What do you think should happen? This patient was in ER, and
Yeah.
he was more concerned about heart attack, and you were more concerned about heart attack. So what should have been done? Obviously, someone coming in ER with chest pain, 50-year-old obese and male, and who is more concerned that he is having a heart attack, the doctor would be more inclined to give treatment of heart attack, right? So
Yes.
the problem is we are FI2. So we are not well prepared for those things. So that is why we involved our seniors. So you told me during the consultation that you did not come to the conclusion, or you are not aware that what exactly is the problem. When you said this thing, the examiner became relaxed. The examiner became relaxed that okay, the candidate did not got to the conclusion, but the candidate is aware that she did not get to the conclusion, and that's why she is involving the seniors, and that's why she is more concerned about the very dangerous and very important heart attack. So you did a good thing. This is needed what in exam. If you are not, let's say for example, if you think that you did not reach a conclusion, then you will accept that I unfortunately I tried everything, but I did not reach to a conclusion, and that is why I would like to involve my seniors, and that is why I would be waiting for their feedback. But until then, I would try to relieve the patient of pain, right?
Yes.
So if anything like this happens in the exam, whether it be chest pain or whether anything else, just accept it that unfortunately I could not come to the conclusion. This acceptance will increase your interpersonal skills marks.
Okay.
Obviously, you will not get marks in management, obviously, but you will get marks in interpersonal skills, that you accepted your mistake, and that is why you want to rectify those mistakes by consulting the seniors. Okay,
Okay.
one or two words for apologies and sorry and this and that. It will also improve your interpersonal skills.
Okay.
Okay. Other question?
No, thank you very much. I understood everything.
No problem, Adela. Just be confident, please, and just practice more. And hopefully, you will clear this exam. It's not something very difficult. It is easy. You are on the right track, and you are doing very well. Okay.
Okay.
Thank you very much.
Thank you.
Is there any question from the audience? Is there any question from participants regarding this station, please?
You mentioned that we should provide them with pain relief in the beginning of the station, right? I know you also talked about it, but I was just can you walk us through how that would work? So we say that we want to provide the patient with painkiller, and then you ask the examiner for a painkiller. Like, how does that work?
Okay. So you want to know whether we should ask the examiner or whether we should just
Yeah,
give
like,
the.
oh, do you just pretend to give them something? Like, how do you do it?
I think you know the answer for this, because whenever you are giving the management plan to the patient, you are not asking the examiner, right?
Mm-hmm.
You are not asking the examiner when you are giving the management plan at the end of the station. So why to ask about this thing in the beginning? Why? You are the doctor there. Examiner does not exist. You are the doctor there. So you will
Mm.
say, let's example, same station, and you start. Okay, start.
Oh, you want me to do the station?
Just start. First 2 minutes only.
All right. Hello, I am Dr. Dhruvi. I'm one of the junior doctors here in the ER. Can you please confirm your name and birth date, please?
I'm David, and I'm 50 years old, doctor.
All right. Hello, David. So I can see here that you're complaining of chest pain. Could you tell me a little bit more about it?
Well, the doctor, I'm having this severe chest pain, and I cannot bear it. I don't know how it comes.
All right. Are you comfortable to give me a quick history right now, or would you like me to manage your pain first?
Please do something about this pain, doctor.
All right. I can give you a painkiller so that we can chat a little bit after that so I can get to the bottom of this chest pain.
Thank you very much, doctor.
Is that
Because
okay?
it's killing me. It's killing me.
All right. I'll give you the painkiller first then.
Thank you. Then afterwards, what would you say? For example, you have given me painkiller.
Uh, do you feel better now?
Yeah, doctor, I feel much better. Thank you very much. It was a life-saving thing.
All right, thank you. I would like to ask you further questions and then I proceed to just going to history taking then.
Thank you, Devi. So you did not ask the examiner, right? You
Yeah.
are the doctor, and you have to give me the treatment management plan, treatment plan, whatever. You will not be asking the examiner. I think if someone says that you have to ask the examiner, this is for the station with that. No, I'm getting old. With the mannequin,
With the Simmons station?
there you have to ask, but here no. Okay.
All right. Okay, gotcha. Thank you.
Yeah, welcome. But one more thing, you also and Adiola also, you told that you were giving me the painkiller. You are not mentioning the name of painkiller. Is this something which is not done or which is common or what?
I think for me personally, I don't know what painkiller would I first give since I'm giving it in the beginning of the station. If I knew it was an MI, I would be giving them morphine, but if I don't know what it is, I would first want to start with giving them an NSAID instead of directly going to morphine.
Why you did not ask me about the severity of the pain in the beginning,
Right. Okay.
right?
Yeah.
So you would have asked me the severity of the pain in the beginning, and you would have asked me about the allergy history, and then give the painkiller.
Right.
Because
Okay. Yes.
to a painkiller and you are giving me that painkiller, so it will be disaster, right? So giving the
Yeah.
pain big needs the severity of the pain, and it needs allergy history,
Mm,
and then you can
okay.
give the, so it works like that. No need to ask the examiner.
All right. All right. Thank you.
No problem. Any questions from any of the participants? Otherwise, we will move to station number 2. No question, I think. So the important takeaway point from this station is expect the unexpected, please. I've already told Adiola data gathering, management skills, and interpersonal skills, how many marks. According to me, I'm not someone who is with the PLAB or GMC. I might be wrong, but according to me, she got 6 marks in this station. Now coming to station number 2, who is the next candidate? Who's the next candidate? Who will perform? Haris, anyone?
Wants to present?
No one? No one wants to present?
I think no one.
So how would we move forward if no one is presenting?
Sir, we can ask Dr. Chui or again Dr. Adola.
Anyone. That's why I'm saying anyone. If Dhruvi wants to do, if Adiola wants to do, no issues.
I
Anyone.
can try.
Your name, please.
Dhruvi, I can try. Since nobody, if there's anybody else who wants to take over, please feel free.
No one, huh? No problem, no problem. Exam stress is like this, so no issues. Dhruvi, when is your exam?
April 10th.
So you have plenty of time. And how you are
Yeah.
doing?
I'm good. I'm doing all right.
Very good.
Trying.
Very good. Okay. So Dhruvi, I went through these. I think you also went through these steps which I changed. And there was a method to this. I wanted to tell all of you guys that station outside what's written, it will help you a lot in deciding what's the problem inside. Okay.
Yes.
But please be prepared for everything. Okay. Now, looking at this is station one, which is on the screen at the moment. You are not sure what kind of patient is inside and what is going on with him or her. But looking at this, yes, you have plenty of idea what's going on inside.
Yeah.
Okay. But again, I'm telling you, maybe you will see, okay, 50-year-old obese patient, male patient, ER, chest pain, yes, MI, heart attack, yes. But it could be simple thing as a reflux. Okay.
Yes.
So please be prepared for everything. Now I will give you your station. This is your station, Ruby. You have 2 minutes. If you don't want 2 minutes and you want to start, you can start.
We can start.
Okay, just let me. Okay, Rui, your timing is starting from now.
Hello, I am Dr. Dhruvi, a doctor here in the ER. Can you please confirm your name and date of birth for me, please?
I'm Samantha. I'm 22 years old.
All right. Hello, Samantha. So here they tell me you're complaining of chest pain. Can you tell me a little bit about it?
It's kind of funny. I'm having a chest pain in the middle, and it's just disturbing me a bit.
All right, I understand. Are you okay with talking to me for a bit, or would you like me to give you something for the pain first?
Good. I'm good, doctor. Please continue.
All right. All right, Samantha, can you tell me a little bit more about when the pain started?
Yeah, I've been having this pain for the past 2 days. It was very mild kind of pain before. Sometimes it was going away. I felt it went away when I was sleeping, but then again it came back. I'm not sure. Kind of funny.
All right, all right. And you told me that it's been 2 days that you've been getting this pain for?
Yeah. But it's
And
increasing.
okay, it's increasing now?
Yeah.
All right. And does this pain, does it go anywhere else, or is it just in the middle of your chest?
I feel like that I'm having this pain in my neck also.
Okay. And do you have anything else along with this chest pain?
A little nauseated. I'm not sure whether
A
this is
little.
food or what, but I feel a little nauseated.
Okay. And you mentioned, does this come and go, or is it a constant pain throughout the day?
It's kind of constant. It's not going away as you can say, but yeah, I feel that it decreased a little bit and then increased, but it was there.
Okay. And if you lean forward, does it get better?
No, doctor.
Does anything else make it better or worse?
Yeah, I'm a cheerleader basically, so I've been practicing a lot, and whenever I try to practice too much, so it increases.
Okay, okay. And have you ever had this kind of pain before these 2 days? Have you ever experienced this pain before?
Healthy, never I died this kind of pain.
All right, I'm going to ask you to rate this pain for me. So, let's say 0 is no pain at all, and 10 is the worst pain you could imagine. Could you put a number on it?
I could probably give it a 6, sometimes 7, but 6, yeah.
All right, all right. Thank you so much, Samantha. Now, just to ask you a few other quick questions. Have you been feeling any dizziness at all?
If now you have mentioned, yeah, sometimes, not always.
Okay. And have you had any other did you face any kind of trauma during your cheerleading practice? Did you fall or something like that?
No, doctor.
All right. Okay. Do you have any current ongoing medical conditions?
No, I'm pretty healthy.
Okay. Are you taking any kind of medicines or supplements?
Just regular multivitamins.
Okay. Do you have any allergies that you know of?
No,
All right. Have you had any kind of surgery or hospitalization in the past?
no.
Okay. Any family history of any chronic conditions?
Well, yeah, my father had an heart attack once.
Okay, I'm very sorry to hear that. How's your father doing now?
Thank you very much for asking. Yeah, he's better.
All right, I'm glad to hear. Okay. And okay, let me ask you a little bit about your lifestyle so that I can better understand where the pain might be coming from. You mentioned that this pain gets worse when you do excessive cheerleading practice.
Yeah,
Is that correct?
for the past 2 days only.
For the past 2 days only. Okay. And is there anything else that you've noticed that makes this pain worse during your daily life?
No, only when I exercise.
Only when you exercise. Okay. And what is your diet like?
Sorry.
What is your diet like?
Well, I'm a cheerleader, so I'm very healthy in all the things. I'm doing exercises. I'm eating healthy, all the things, vegetables, fruits, meat, everything.
All right. Also, a few other quick questions. Do you smoke, Samantha?
Never,
Okay. Do you consume alcohol?
never.
All right. Um, and who do you stay with? Who do you live with?
I live with my boyfriend.
Okay. Are you sexually active?
Obviously.
Okay. Do you use protection?
Yeah.
Okay. When was your last menstrual period?
Was probably 2 weeks back.
2 weeks back. Okay. All right. Thank you so much, Samantha. And
Yeah.
I would to make sure that to get to the bottom of your chest pain, I would like to do a general physical exam on you and do a physical exam for your chest. Is that
Okay.
okay with you?
Yeah.
Okay. And any tenderness? Any
No tenderness, but on examination, no, nothing.
nothing. Okay. I'll also take your vitals to check your blood pressure, check your BMI.
Yeah, blood pressure is a little high.
Okay, BMI.
BMI is normal, healthy.
Respiratory rate. A respiratory rate.
All normal. Rest of the vitals are
Oh,
normal.
okay, all normal. Okay. Um. All right, Samantha, to get a better idea of what might be going on, I'm going to get a few blood tests for you. Where we can see your full blood count, we can see your blood sugar, and also your hemoglobin levels to see if you might be anemic.
Yes, doctor.
And I also want to get a chest X-ray for you just to see if there's anything else going on with
Sure.
you. Also, I would like to quickly again ask you, do you have any shortness of breath?
With this pain, yes, when the pain increases, I do feel a little short of breath.
Okay. Do you have any history of asthma?
No.
Okay. All right. Would you have any idea of what might be causing this pain for you?
No idea, doctor, because I'm very healthy, but for the past 2 days, I'm not sure why I'm having this pain, nausea, and especially when I exercise a lot, yani when I do my routine.
Okay. Do you have any specific concerns for me?
Just see what is this pain, this funny kind of pain.
Okay, I'm also going to add a CRP and ESR value in your blood test so that we can see if there is some kind of infection going on for you.
Your 8 minutes have passed, but please continue.
All right. Just to quickly, we'll wait for your blood results to come back, but along with that, currently I am highly suspecting that this might be either an infection in your rib cage that's called costochondritis, or it might just be something as simple as a muscle pull, since you did mention that you are a cheerleader. So I'll get you started on some NSAID, some painkillers to better manage your pain. And then once we get the test results back, we can see how to better approach this pain of yours. I'll also involve my seniors to see what's going on here.
Okay, thank you, doctor.
All right, thank you, Samantha.
Okay, thank you, Rui. Thank you very much. Confused, I think, right?
Yeah, I was very confused. I couldn't get to what is the diagnosis.
Okay, I'll change my strategy a little bit and I will tell the diagnosis first and then we will go one by one, okay?
All right.
So the diagnosis was angina.
In a 22-year-old.
That is why I'm always saying that please be prepared for everything.
Okay.
So please don't just go on the writing outside. Please be prepared for everything. That first patient was a 50-year-old obese male inactive patient. Yes, and you guys were thinking about a heart attack, although he did not have. Now this patient, she was just 22 years, healthy female cheerleader with chest pain, but you are not thinking on that heart attack case, obviously, because she's just 22 years old, she's healthy and everything. But you have to be prepared for everything. I specifically made these stations and I specifically made this slide to tell you that expect the unexpected because you will face some kind of stations there. Although much of the stations there are very easy, okay, like you are expecting, but there are 10 to 20% of the cases where you believe that this is the case, but this is not the case. Okay. Coming to the station one by one. You asked about the pain. You asked about having a painkiller. Very good. Your introduction was very good. And then you continued with the Socrates' questions, so that were also very good. You asked about radiating. I told you that it's radiating in my neck. I'm also feeling nauseated a little bit, and with that thing, although of course Socrates only cannot help you in diagnosing whether this is a heart attack or not. Okay, so you have to ask other questions also. So you asked other questions. You asked some of the red flags, like I think you asked about dizziness. So I told you that I am feeling a bit dizzy. The important thing you asked about, how did it start? I told you that it's been there for 2 days. It was mild and now increasing, and it comes with my activity. You did not ask about the relieving factor. Well, if you have asked, I would have told you that it gets relieved when I get rest. Although I did try to tell you in the middle, but you were not listening to me. I think you were probably having some interruption. I don't know, but you were not listening to me at that point. So basically, Socrates and red flags. Then you came to my past history. Of course, past history was very much normal. Medical history was normal. No surgical history, nothing. So there, she was a very healthy female. So no problem with there. You asked about my diet, exercise, my sexual history. Very good, yes. Because you were more concerned that it is some kind of infection. So you went through sexual history, you went through CRP and everything. So it is understandable, no problem with that. The medical history you asked, allergy, family history. I told you that my father had a heart attack. And the brilliant thing you did was ask about his condition. That's a very, very, very plus point there. Okay. This shows that you are very much concerned about your patient and the person related to your patient. So that was a pretty much a very good. I can say that you had a very good effect on the exam there. Okay, you did my vitals. I told you that vitals, my blood pressure is a little high. Okay.
Yeah.
But ask about temperature. Otherwise, I would have told you that there is no temperature. So if there is no temperature, I think you would not have gone to CRP and everything, right?
Yeah, the infection would have,
Would have been cleared a little only, yes. So you did not ask about. That's why I'm always telling that when you mention vitals, please mention temperature, blood pressure, pulse, respiratory rate. You did ask respiratory rate. You did ask blood pressure. Otherwise, I told you that everything is normal. All vitals are normal. I told you like that.
yes.
Okay. Now, the main thing which could have guided you in this station was ECG. I had this paper with me. I had the finding with me of ST segment depression. But you did not ask me about ECG. You did not do my ECG. This was a chest pain patient, and you did not perform an ECG. So this was a very, very big blunder. A chest pain patient, whatever the age, whatever the cause, you have to do the ECG. Bloods, cardiac enzymes, these, yes, they are important, but without ECG, I think you will lose a lot of marks. Okay.
Yes.
So please, I had this ST segment depression finding with me. Okay. Now during examination, you did not ask about the chaperone also. So again, that is a negative point. You asked about the examination findings. I told you everything is normal on examination. You asked about my concern. You asked about my idea. I told you about that. So that's a very good plus point. Obviously, management part, you involved the seniors also. You tried to reduce my pain with painkiller. That's very good. But since we did not get to a conclusion, so you could not finish the management. The management part is the very, very commonest thing to be left in the exams, because most of the time, the candidates or the participants, they did not reach a conclusion. Whenever they did not reach a conclusion, they cannot tell the management, obviously. Okay. So these are just few of the plus and negative points here. Now, what do you think? How would you rate your presentation?
I mean, I didn't get to the diagnosis and hence the management, so I don't think it was that great.
Okay, so let's again one by one. Data gathering. How would you rate data gathering?
Probably a 2. I jumbled quite a bit, and I also missed out on a few questions that I should have asked.
Yes.
Maybe a 1 or a 2?
Not definitely not 1, a 2 or a 3. Okay.
Okay.
Why? Because you asked Socrates and you asked about my past medical history, my allergy history, my family history. You asked about that. And the most important thing in chest pain scenarios is the red flags. So you were going through the red flags, but you asked only 1 or 2, no problem with that. So probably a 2. Yes, definitely a 2, but probably a 3 on data gathering.
Okay.
Now, management skills.
She was having angina, so probably not there.
Yes, because she was having angina. You asked about the painkiller, you gave me the painkiller, but the problem is she was having angina. Now, if she was not having an angina, I would have given you a 2. But since
Right.
she was having angina, so I'm giving you only 1.
Fair enough.
Okay. Okay. Interpersonal skills.
Maybe a 3?
Yes, you got 3 there because again, you asked for the painkiller in the beginning. The two things which gave you 3 here are basically you asked for the painkiller in the beginning, and then you asked about her father. So these two things gave you a good impression and gave you a 3 in interpersonal skills.
Okay.
Okay, so 3, 1, and 2. You are again on 5 or maybe 6.
Okay.
Why? Because this was a station of angina. Angina should not be missed. MI should not be missed. Obviously, we have to first think about angina and MI. So if a candidate, for example, sorry, if a candidate is missing angina or MI, no matter how good her interpersonal skills are, definitely the doctor will say, yeah, interpersonal skills were good. She was a good doctor. She was a safe doctor, but she missed angina. So maybe not good for her, not good for the cheerleader. So maybe 5 you will get there.
True.
Okay.
All right. Thank you so much.
No problem. Any questions?
No, thank you.
Okay. Any questions from the other participants? I can chat history. No, sir, Zarar. Okay, Zarar. What other questions we have here? All the people left. They did not like me. What's common? What is flaw? JP, you asked about flaw. Are you still there? I think the Dr. Adiola mentioned flaw. This is fever, lumps and bumps in the body, appetite changes, weight changes, and S is for night sweats. So this is basically flaws. I don't get it. What you did not get it, Fariha? Please tell me. Got it. Oh, okay, very good. And she left. So we have 15 participants. I don't know. You don't have any questions there. Either I was very bad in giving the presentation and calculating, or you all are very good. No problem. So I hope we will have more these kind of presentations in the future, inshallah. And what else do I have here in my presentation? Do I have something? Oh, station 3. But I will not go through station 3 because we have taken a lot of time. You explained everything well. Thank you. Nabil, thank you very much for such kind words. You are really helpful. I hope you are not from Med Instutors. Okay, this was my station 3, but I'm not going through this. Okay, the important thing is take home message from this presentation of today. Now, these are my take home messages. First impression is the last impression. Please remember, guys, You have to be well dressed. You have to look cool. You have to look good. You have to look hot, whatever you want. Just be at your best. Okay. So, because first impression is the last impression, no matter what we do inside, the examiners are, after all, human. The patient is, after all, human. If your first impression is not good, there is a chance that patient will not probably like you, and probably he will not, or she will not help you. Although there is very little chance of this. But again, first impression is the last impression. If you have impressed the examiner, he will probably give you more marks. Again, he is a human. So please, your impression should be good. Show empathy, definitely. In our practices, in exam, everywhere, empathy is the main thing of being a doctor. The approach should be patient-centered. I think you guys must have known this for the many ages, and doctor-centered approach has been in the past. Yes, there was doctor-centered approach. Unfortunately, there are few doctors who still practice doctor-centered approach, but it should be changed, and it should be patient-centered approach. The very dubious question, we have to memorize the questions. Yes, you have to memorize the questions, otherwise you will not complete the station. So yes, you have to memorize the questions. In our two stations today, both of my very good participants, Dhruvi and Adiola, both have memorized the questions. So that's why they were able to complete a little bit of their station. So yes, you have to memorize the questions, but you have to adapt also. If you are not adapting, you will lose marks. And in the last, expect the unexpected, because it is very important. You might make up your mind outside that it is heart attack, and you will continue with this approach inside for 8 minutes, that it is a heart attack, it is heart attack, it is heart attack. And you will come to know that no, it's not a heart attack, it's simply a reflux or maybe a musculoskeletal injury, like this. So please do see the station outside, do make up a little bit of mind outside, make a few diagnoses, differentials, not 2 diagnoses, make at least 4 or 5 diagnoses standing outside the room, and then explore those diagnoses inside. Okay, thank you very much all. I hope you don't have any questions for now, because I'm asking again, but still, if you have any questions, please let me know. And I hope if you like my presentation, I will be given a chance again to present again. Otherwise, the Instutors will not give me a chance. Dhruvi, welcome. Thank you very much for presenting the case. Thank you very much for coming in front and presenting. You know, this we have to come forward. If you are not coming forward, if you are just if you're just being shy, it will not help. So coming forward is very important. Adiola, thank you very much. So nice of you. Your presentation was very good. Again, a few mistakes, but not much. I liked your confidence. I liked Dhruvi's confidence. So you guys are on the right track. Just a little bit practice and you will ace the exam, hopefully. So thank you very much, guys. Thank you very much. We will be leaving now. Okay, take care. Practice, 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 and take care. Thank you very much.
Thank you so much for the wonderful session, Dr. Adnan.
Haris, thank you for giving me support. Okay, take care. Bye all.